Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Shafer. Welcome to Monday Health Minutes with Valley Health. Peer support therapy. It is where people come together and help each other through so many of the things that they're dealing with, offering emotional support and personal care and practical help. It can be very helpful in a lot of walks, including in recovery. So today we're talking to peer support recovery specialist Suzanne Krueger about what the process is today and what it looks like. So thanks for joining us today.
Thank you for having me.
Yeah, I think this is going to help so many people. Tell me how peer support therapy differs from maybe traditional therapy.
So I think the biggest factor is that I can share more in depth about my personal experience. I can divulge information that traditional therapists have to kind of keep to themselves. So it makes me more relatable to the patient. It makes them more willing to trust me because they're seeing that I've been through similar things or sometimes identical things that they've been through.
Maybe help people feel not so alone.
Right.
They hear what other people are saying and are like, I've done that. I've felt that. Yeah,
right,
it
because
can be great.
Addiction is, the opposite of connection. So peer support allows connection within these terrible times that for me, my peer support was an insurmountable ally through my process. So I just want to be that for other people.
That's really neat. Thank you for sharing that. That's important that people, hear that from other people on how helpful it can really be. So you mentioned connection. What are some of the other key benefits of that coming together in peer support therapy?
So I am able to really handhold someone through each process they go through. I've helped people apply for housing. I've helped people apply for assistance that they need. We've brainstormed on ways to get people back in school. We've helped people find employment through the resources that are available. And a traditional therapist, while they can provide those resources, they don't typically walk through the process with them and meet them for each thing that needs to be done to complete those processes.
And that can be so invaluable because when you're going through something, sometimes you can just get frozen and not know how to take the next step.
And oftentimes people, especially early in recovery, have severed those connections with the family support that they have. So having someone in their corner while they work to repair those relationships and still fulfill their responsibilities as an adult is instrumental in your recovery. It was for me.
Talk to me how important it is to hear that other people are going through similar things as you are.
I just think that it is so important for them to know that they're not alone in that. Because when you're in active addiction, you can be in the biggest room of people who truly do love you and feel so alone because of the isolation that happens with active addiction.
There's nothing like talking with somebody who knows exactly how you feel. Now, I know peer support is different than traditional therapy, but how can it complement it?
We work hand in hand with the therapist. So if a therapist meets with a patient and they've expressed that this is a barrier that they're having or this is an issue that they're having, they can bring that to me and we can really dig into the nitty-gritty of it. You can really dig into the nitty-gritty of the process and why these things are occurring and how to overcome them, and then you take that back to the therapist and the therapist can see the progress and they can move forward in whatever needs to be tackled next, and then that problem gets brought back and we problem solve it again.
Just really complements each other.
Very much.
Is there anything that makes peer support therapy more effective?
I don't want to say it's more effective because I think everything is crucial. It all has to work well together to be successful, but I do think that the being able to share my experience with the patient is key for them to trust the process. And if they trust me and then they see me trust their providers, it
all works
much more smoothly.
How do people take advantage, or how do people connect and find peer support?
Well, in our program, everyone is assigned an appointment with me upon intake. So I meet with everyone initially, and then we have several that have chosen to continue services throughout. Sometimes they don't, and then if they hit a bump in the road, then they can be referred back to me by their therapist or their medication provider, or even sometimes their primary care.
All right, peer support recovery programs, a tool in the toolkit to help people get healthy and go through recovery. Suzanne, thank you
Absolutely.
so much. I appreciate your time.
Thank you so much for having me.
Thanks for checking in on Monday Health Minutes.